The question in cases like this all the time is, do we close the gap or do we keep it open? Well, in this case, we close the gap. And I'm going to go through exactly how I approach that, how I need to finish the veneer in order to properly close the gap, and then also how I went about making sure that color, shape, and shade, everything matches well. For example, a case like this, not him. She wanted to keep the gap. She wanted to keep the gap, just make the teeth a little bit prettier, longer shapes, prettier proportions, but maintaining the gap because that's her identity. Versus him, he didn't want that. What he wanted to do, and what we're going to work on here, is there's a tooth that's smaller, significantly smaller. We always talk about having a gap between the lateral, or rather having a step between the lateral and the central. In his case here, we are looking at this, and I know that he's too short here. So I'm increasing length. How do we increase length in the centrals? Closing this gap, right, without making the tooth look too big. In his case, his smile covers the top portion of his tooth. So this is his biggest smile. When he talks normally, it shows even less, right? So we're increasing the length here, therefore having to increase the length of these laterals and coming across and doing the exact same thing. In a case like this, where we're trying to match beautiful natural teeth, we only needed to do 4. So we fast pass forward this. In a case like this, where we're looking at all of the details, all of the line angles, the way that his tissue is, where his papilla end. This is super important in understanding the preparation. I'm going to go into it. What my mentors talks about all the time when we were working on these cases is hiding the margin between the tooth and the porcelain, which is tucking in the elbow, right? Creating that kind of preparation, really making sure that you tuck in the elbow so that as you're into the preparation and the veneer comes out, it's not too bulky where you're violating the tissue. And so you're covering the natural tooth with the porcelain so you don't see a transition between the porcelain and the natural tooth. These are really important things to think about in a case like this, how little you actually need to shave in order to get the outcome that we're looking for. An important component in here is to know that he didn't want to bleach his teeth. He liked the color of his teeth. And so if I analyze the color and shade of his lower teeth, I know that I like this color. I like the textures here. I like the translucency. I like the shade. But I'd want to go about 1 shade lighter, which we spoke about. And on 4 front teeth, it's okay to go a little bit of a pop in those front teeth because the canines are a little darker, and those teeth are our transition teeth as we migrate towards the back teeth. So here's the veneers on the model. We're looking at the translucency that's definitely here. We're going to look at these sort of mamelons, which I'll show you a photo from the profile that you can't see here, how we accomplish this. And also, obviously, the arch form as we move from the centrals to the canines. So his case right here, from the buccal, which is from the facial part, we're seeing that the position of it, the arch form is really good. So we're going to have to reduce some of the front part of the tooth so that the final porcelain doesn't stick out of the mouth. So there are cases where we're doing additive, there's cases where we're reductive, or basically in this case, we're trying to utilize the porcelain veneer to finish the exact same position front-wise, obviously not lengthwise, but from the front as it was originally. And then finishing the veneer from the back. So look at how this V of his teeth really tucks in there. So it's important to understand how to prep for this type of case. Here we go. First of all, let's look at these preparations. Okay, we do the finish lines from the back over here. As I told you, that elbow right here, really making sure that we're conscious of where the tissue is and understanding the preparation. So we're reducing. And one of the most important parts on closing the gap type of case is really making sure that you go about 0.5 millimeter subgingival, underneath the gums, so that as the veneer comes out of the profile of the tooth, there isn't a black triangle and that it looks really nice and healthy. So this is really all you need on a veneer, is a thin shell of porcelain that slips over the front and around the back side. And this is what the final outcome looks like on the porcelain on the model. You have to make sure that you finish that porcelain in between two teeth. So the indication for breaking contact or finishing the porcelain on the back side of the tooth is if the patient has decay, if we're changing position of the teeth, or if we're closing gaps. Obviously, there's a few more, but those are the main three reasons why you would finish the porcelain veneer on the back side of the tooth versus finishing the porcelain veneer and not having to break through that contact. If he had cavities or fillings here, then we'd finish the porcelain veneers like we would if it was a back tooth, that we would need to tuck the porcelain veneer in through the contact point, which is a slightly similar concept, different application. This is all the same types of concepts, just understanding where and how to apply these different processes. So here it is. From the back, that area is closed. Those V's are now closed off. Porcelain is finished exactly where we want it. So take a look at this right here. I just want to erase that. That is how you close the gap. The tissue is healthy right there. There is no black triangle, no space between those teeth, and this is his final outcome. I want to just see, this is where we started. So if we analyze where we started to where we are finishing, you can see now how that flows with the architecture of his lip. It looks extremely natural in person. And this is that character that in those mamelons that are texture created, that from the front of the photos you haven't been able to analyze or visualize it, but in real life, this is what makes a tooth look real. These details are critically important. There's also a part of it which is like, you don't want to overdo it. You don't want to create too many textures where it looks artificial, which a lot of people looks good on photos, right? A lot of people all over the world like to really exaggerate this, but what does it look like in real life? My goal is for it to look like a natural tooth for the patient. So remember I said this is the color of his lower teeth. We went a little bit brighter on the top, and then as we transition to the canine, it sort of starts to darken as the canines are a bit darker than the rest of his front teeth. And the goal is to always create a smile that is confident, that's beautiful, and will last many, many years. 15 to 20 years, a case like this where we maintained a lot of enamel, I don't see why not.